there is no scope for non-operative management of gallstones. So a lot of people, in the olden days, in the 1920s, 1930s, people tried non-operative treatment of gallstones. Medicines were introduced for gallstones. They would actually go in and cut the gallbladder out and take the stones without removing the gallbladder, or they would put a needle into the gallbladder and try to dissolve the stones with some medicines. None of these worked. So for example, medicine called ursodeoxycholic acid, which is still available now, we use it for other conditions. It was initially tried for gallstones. When patients took it for 2 years, around 15% of the patients had their stones dissolved, but the patients reformed gallstones within 3 months. Likewise, when they cut the gallbladder or try to dissolve the stones in the gallbladder with some injections, these stones reform. Subsequently, our understanding of gallstone disease has improved. Now we know that the problem with, like for example, in kidney stones and gallstones are as different as apples and oranges. In kidney stones, the kidneys are normal. The problem is the stones. So the size and the number of stones, we make a decision based on that and remove only the stones. In gallbladder patient, the problem is not the stones. The problem is the disease in the gallbladder. So if treating only the stones will always lead to a recurrence. So the problem being in the disease in the gallbladder contractility, the contraction of the gallbladder is weak. So you actually have the stones which form. And so the treatment for gallstones world over is removal of the gallbladder. That is the only accepted, safe, simple treatment. It's one of the commonest operations we do. The gallbladder is removed with the gallstones. And it's a daycare surgery. Usually we do the surgery in the morning. By afternoon, we send the patient, or the next day morning. And once the surgery is done, you'll never have your symptoms for the rest of your life, and the risk of complications is also gone.